Guys, Davin Lim, board certified dermatologist. In today's video, I'll be talking more in depth in regards to darker skin types and the settings we use in lasers, the fundamental differences between treating lighter skin types, darker skin types, and the types of lasers and energy devices that we employ to make treatments most importantly safer, but also effective in both ethnic and dark skin. So let's talk about the biology of darker skin types. So for darker skin types, there's a few issues. First of all, they've got more melanin content. So when you look at the melanocytes, or the number of pigment cells that reside in the skin, it's the same. However, the melanocytes are more active. In other words, the pigment cells can get stimulated easier to different things, for example, like UV light. They also have receptors on the melanocytes which are more prone to basically stimulation using blue light and visible light, which is your high energy visible light. So in summary, the melanocytes or pigment cells are more, reactive, and they also react more briskly to certain stimuli. Additionally, the melanosomes, which are the packets of which melanin is, in other words, the pigment packets, are usually increased in size. They're also larger. The other thing with darker skin type as well is that they have more reactive fibroblasts. In other words, the cells at the bottom of the skin, in other words, the dermal layer, are more reactive. And hence that's why darker skin types will have increased incidence of keloid and hypertrophic scarring. The flip side is that if you have more reactive fibroblasts, chances are with various stimuli, for example, heat, you can create more collagen. When that happens, generally speaking, you're going to get a better response to heating devices as well as stimuli which may stimulate the fibroblasts. In other words, your collagen stimulating fillers. The other important thing is that one protects against the other. For example, if you have pigment that resides on the upper layers of skin or your epidermis, that reduces the transmission of light. So for example, your UV radiation and your infrared radiation basically is reduced because of the melanocytes or the melanosomes. With a thicker layer of melanin protection, in other words, protection in your epidermis of your skin, that protects the underlying layer. So if you can think about it, it's like a filter. So darker skin types will have a filter there which filters the penetration of UV light into the deeper areas of skin. That's why when you look at photoaging, when it comes to loss of collagen, for example, darker skin types usually for age-matched populations have less photoaging compared to lighter skin types. So those are the fundamental differences of lighter skin compared to darker skin. Now, how do we apply this to lasers and energy devices? So firstly, with lasers, we need to consider a few things. We need to consider the bypass theory of lasers. Basically, when a wavelength hits, we want to actually use a longer wavelength that penetrates deeper to bypass the pigment in the upper layers of skin. That's why when we're using hair removal lasers, for example, or treating for skin rejuvenation, we want to use a longer wavelength. So something like a 1064 is better than a 755, which is better than a 532. So all of these basically describe the wavelengths of light. So remember, for darker skin types, you want to penetrate deeper, you want to bypass the pigment in the skin and go to the deeper layers, and hence a longer wavelength is advisable. The other thing to consider is your melanin absorption. So in some cases, you want better melanin absorption, in some cases you want less. So you select a wavelength depending on where your melanin is. Now, it's important to consider other aspects. For example, because your melanocytes are more reactive, in other words, when you have a heat source that produces more melanin, what we want to do is we want to slow down that process. And what we can do is to cool down the upper layers of skin. So for example, if you're treating skin but we want to protect the epidermis, we may want to use a device or a laser with a cooling system. So if you don't have cooling system, some of us actually use ice on the area, treat then re-ice, right? So that way it can reduce the amount of inflammation and stimuli, including heat, that may evoke a greater or more brisk response to your pigment producing cells. The other thing as well is to use something called a longer pulse duration. So in other words, instead of delivering a lot of heat over a short period of time, you want to deliver the same energy over a longer period of time. And this is very important when we're using hair removal devices. The other thing which is also super useful is when you're using vascular lasers or pigment lasers. So to use a longer pulse duration when you're using, for example, something like a V-beam or vascular laser. So instead of delivering a short amount of energy or the appropriate energy over a short period of time, you want to increase the length of which that same energy is delivered. Now, this is where it gets a little bit complex, because when you're using ablative devices, something like an Erbium or CO2, it's converse. So basically you want to use energy over a short period of time. because what you want to do is preserve that hold that you're giving through the entire skin layer so that the amount of heat dissipation is minimal. So basically, if you think about it, it's drilling holes which are actually very, very narrow compared to big holes, because when you drill big holes in the skin, in darker skin types, you increase the thermal load of the skin, and hence you may increase the chances of post-inflammatory hyperpigmentation. Now, another important concept, which I guess is easy to understand, when you're doing fractional devices, in other words, devices that don't deliver a full beam of energy, in other words, packets of energy which are scattered on the skin surface, that may be from 1% all the way up to 70%, that can decrease the thermal load of skin. So that's very important. So that's when we're using pico devices and we're using ablative lasers. That's when fractionation can actually be beneficial when you're treating darker skin type. Once again, that's to decrease the amount of thermal load in the skin by spreading it out. Instead of doing the full area, you're doing partial areas. Another important concept to understand is randomization within those dots. So if you think about it logically, you've got a dot here, a dot there, a dot there, a dot there. When we're using a scanner, for example, when we're using a fractional devices, it may lay dots which are sequential. In other words, next to each other. When you do that, there's an increased amount of thermal load within the tissue itself. That's why most good lasers, especially when it comes to things like ablative lasers, they use a randomized pattern. In other words, a dot here, 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 etc. When you use randomized patterns, when you're scattering the amount of thermal load, you decrease the amount of post-inflammatory hyperpigmentation. In other words, you decrease the amount of heat adjacent to each other, and hence you can allow the tissue to cool. So that's super important. Hence, in summary, guys, when you're treating darker skin types, there are certain things that we can't change. We can't change the biology of skin because that's universal. We can, however, think about how to provide better, safer treatments for skin of color. Guys, I hope you enjoyed that video. It's a little bit more abstract in how I normally do things, but I like to mix it up in this channel. Catch you next week.